Assalamualaikum warahmatullahi wabarakatuh. My name is Leonie Agustin Iswara with NPM H1A021052. In this video, I would like to present a medical article with a title Sleep Duration and Sleep Quality are associated with a physical activity in elderly people living in nursing homes were published in 2018. In this video, we're gonna discuss about first, introduction, second, materials and methods, third, result, fourth, discussion, and fifth, conclusion. First, we're gonna talk about introduction. Physical activity or PA represent an important factor for maintaining health in the elderly. Elderly people are almost 2 times more likely to have a physical or mental disability and are 4 times more likely to have some physical limitation compared with a people aged under 60. Thus, an encouraging regular PA in elderly people has been the goal of a many governments worldwide in order to prevent certain disease and reduce a mortality rate. Sleep duration is among the numerous factors that can be potential influence PA. Previous studies have reported the elderly people aged more than 65 suffer from a variety of sleep problems, include both short and long sleep duration. Studies conducted among a Chinese community developing elderly people show the both short and long sleep duration was associated with a poor physical performance compared to individuals reporting 7 to 8 hours of sleep. However, older people need optimal sleep duration and high sleep quality in order to perform both a physical and physiological function properly. Although the numerous studies have shown the association between physical activity and sleep, little is known about whether sleep predicts a physical activity, especially in elderly populations. Therefore, the main purpose of the study was to explore the association of sleep duration and sleep quality with PA. The first hypothesis was that elderly people reporting short or long sleep duration would be less likely to meet a PA guidelines. Our second hypothesis was the elderly people living in nursing homes and reporting a good sleep quality would be more likely to meet PA guidelines. And the second, we're gonna talk about the materials and methods. First is a study participant. In this cross-section study, participants were largely independent. They had their own apartment, were taking care of themselves, were free to go out in the city, and were living in nursing home for the sake of security. A second is a PA assessment. To assess PA over the last 7 days, we used the adapted version of the IPA short form, a reliable and valid instrument designed to measure PA in a respondent aged more than 65. The questionnaire elicits information about time spent each day engaging in light, a moderate and vigorous intensity PA, and the number of days on which they occurs. For each participant, we'll calculate the overall time spent doing moderate and vigorous PA. Third, it's sleep duration. Sleep duration was assessed by asking participants, on average, how many hours of sleep do you get it in 24 hours period? The participant was a numeric variable category into 5 groups for analysis. First is a very short sleep. Second is short sleep. third is optimal sleep, fourth is long sleep, and the last is a very long sleep. Fourth is its sleep quality. To assess sleep quality, we use the Pittsburgh Sleep Quality Index or PSQI. This is a composite of 19 equations which are relevant 7 major components. And the fifth is covariates. Separate health represents using a one-item equation. How how would you rate your health? Answer will arrange along an ordinary scale of follows. First is a very poor, second is poor, third is fair, fourth is good, and the last, fifth is excellent. And a sixth is data analysis. Basic describes a statistic of the study. Participants are present are frequencies and percentage. Difference between a categoric variable was analysis using chi-square test. We use a generalized estimating equation model PA as a binary outcomes using a logistic regression matrix. We also use a Pearson method for residual because is it a plausible that sleep duration and sleep quality are independently associated with a PA. We examine the association between sleep duration and surveillance PA in a model 1 and between sleep quality and surveillance PA in a model 2. And the last, we entered the sleep duration and sleep quality simultaneously into model 3 to examine the association with surveillance PA. And the third, we're gonna talk about the result. At the time this study was conducted, each nursing homes has 215 to 300 users, and the univariable analysis is relevant to statistical difference in size of nursing homes between those who did and didn't participate. We also test for potential differences in sleep duration and sleep quality PA and covariates between the chosen nursing homes and those not selected using chi-square test and found no significant difference between the nursing homes. The association of sleep duration and sleep quality with surveillance PA are present in the tables. After adjusting for sex, self-rate health, smoking, alcohol consumption, physiological distress, socioeconomic status, and chronic disease, data were entered separately into Model 1 and Model 2. Participants reporting short sleep duration were less likely to report surveillance PA, yet those reporting long sleep duration and a good sleep quality. In a Model 2, we more likely to report a surveillance PA. When both variables were entered simultaneously into Model 3, the same association remained. Additionally, we wanted to explore whether our covariance has an influence on the association between sleep duration and sleep quality with PA. After entering only sleep quality and sleep duration separately into the analysis, participants reporting short sleep duration were likely to meet the PA recommendation, yet those reporting long sleep duration were more likely to meet the aforementioned recommendation. And the fourth, we're going to talk about the discussion. The main purpose of the study was to explore the association of sleep duration and sleep quality with PA. Our first hypothesis was that both short and long sleep duration will be associated with no meeting to PA recommendation for elderly people aged more than 65. However, our result only partly confirmed this hypothesis as a participant who reported sleep uh, less than 6 hours were likely like to meet the PA recommendation, yet those reporting sleep more than 9 hours were more likely to meet the PA recommendation. Previous studies have reported the short sleep duration is associated with a lower PA level in elderly population. However, one other study showed that no significant association between sleep duration and PA. An individual who reported fewer uh, depressive symptoms. In general, previous studies have shown that short sleep duration is associated with a decrease in maximal oxygen uptake and increase in exercise as selected injuries and daytime tiredness and fatigue and leading to reduced regulation participation in PA showed the engagement in PA, although small, had a significant beneficial effect on total sleep time. Thus, the PA may promote longer sleep time, especially in elderly individuals. And our second hypothesis is that good sleep quality will be associated with a surveillance PA in the elder. The reason we use both sleep duration and sleep quality as a predictors of a PA was the both a variable have been consistently associated with each other and in it has a profitably the both sleep duration and sleep quality should be taken into account for public health. Also, both variables have been consistently associated with a similar negative health related outcomes. And the last, we're gonna talk about the conclusion. Our study showed the elderly people reporting short sleep duration are less likely to meet the PA recommendation for their age group. Yet those reporting long sleep duration and good sleep quality are most likely to meet the same recommendation. This result presents some new evidence of the independent association between sleep duration and sleep quality with PA in this population. Our finding a suggestion that long sleepers and those reporting a good sleep quality are more likely to meet PA recommendation. Okay, that's all from the part for all the parties presentation about sleep duration and sleep quality are associated with a physical activity in elderly people living in nursing homes. And thank you so much. And wassalamualaikum warahmatullahi wabarakatuh.